No.
Ow.
It was some cool things that I brought in, some stuff I've got in my, so I got an actual, I finally like sucked it up and bought me a junctional tourniquet. A SAM junctional tourniquet. But I've also got a couple of, they're called boa constricting bands. They're an IV tool for hypovolemic patients. But I'll show. I've got one. They're a military thing. I brought a couple, and a couple of the medics saw me in the field and were like, "This is awesome." Then some folks saw me in the hospital and were like, "What is this?" Because we were using them during our clinicals. Some of the folks from the hospitals got them.
Are they reusable?
Mm-hmm.
Can I have one if you got
yes,
an
they're reusable, but I mean they're designed for a single use, but we've used them over and over and we just disinfect. You know, they're designed for multi-use on like a single incident, but they're not that expensive. They're like $6-7 depending on where you buy them from. If you buy them full
I wanna
price,
see
it's
how
about
it
$10. So you know the little constricting bands, like the rubber ones?
Yeah.
So it's a tube of that around the spring. So it's got a lot of tension. And then it's got a plastic buckle at the end of it that's also round. But what you do is you take it and you stretch it around the arm here, and when you lock it, it is tight, but you start as high up as you possibly can. And then you roll it down the arm. So what it is,
so it pushes
it
down.
forces all the blood distally.
Awesome.
Now, that's not gonna do anything at all for somebody who just has crappy veins. This is not gonna do anything for your 60-year-old diabetic patient that is overweight, has neuropathy, has all this stuff. What it is for, it is specifically for a patient that has good vascular normally, but they're hypovolemic. So I've got great veins, but I don't have any blood in them. So you put this on and you roll it down, and all of a sudden all the veins just stand up and they're engorged with blood. Now, take away from that, there are little tricks and tips that you guys can do out in the field to accomplish the same thing if you don't have one of those. If you're having a whole lot of difficulty getting an IV on somebody, now again, it cannot create veins, but if you just have somebody who's hypovolemic,
But it can show me.
take an ACE wrap. Say you've got somebody that's a trauma patient and you're trying to get some kind of vascular access. Now granted, we're only doing that because we've done whatever hemorrhage control, everything we need to. But take an ACE wrap and put it around real tight and just start wrapping lower and lower and working down with that, wrapping that ACE wrap super tight, and you can accomplish basically the same thing. So, on that note, there was somebody pointed out a class I had this last weekend. There was a military surgeon there that was saying that he had some guys that brought in. They had a patient that was a prolonged extraction, and they had no whole blood product, and they had no infield transfusion kits. They had nothing for him. But what they did was he had a traumatic left leg amputation. They put a tourniquet on him. Well, he was altered and then he was unresponsive, or unconscious rather. And they couldn't, so they'd already put a tourniquet and they put it up as high as they could, so they'd done that. But he used the blood out of the other leg. He started super low with an ACE wrap and wrapped it as tight as he could and forced all the blood up and then put a tourniquet on it. Then they took puffy gauze and rolled it up on the arm that did not have the vascular access. This arm, yeah, on the arm that didn't have the vascular access, and then put a tourniquet on. And they said that by forcing the blood, the doc there was saying that in your extremities total, you have 15% of your blood volume is spread out through your four extremities. Now, granted, they were only taking out of one leg and one arm because they were leaving this other one accessible, but they said that it increased his blood volume enough that it improved. They said he had a palpable carotid pulse after they did that.
How would you?
Ooh, that is so cool.
They started low with the wrap and wrapped super tight so that it reduced the vascularity, which
That is cool.
that was
That is
the
life
boa.
saving right
no,
there.
the boa wouldn't so much. Because the boa is not going to reduce basically what they were doing years ago. There was something that was called masked trousers.
But they was taking the blood.
And so he didn't really
They was making the
anything
container
monumental,
smaller.
but
in a sense.
he made something that used to be super, like the go-to in the field for a while was this thing called mass trousers. And what it was is a pair of pants that inflated like a blood pressure cuff. And so they would put this pair of pants, if you were a trauma victim and you lost a lot of blood, they would put these pants on you and they would inflate them. And it would compress, make the container so much smaller and force all blood out of your lower extremities and give you blood volume. The problem was, it wasn't used properly and it wasn't received in the hospital properly. So like everything else, rather than training people up, we dumb things down. And so, because what people in the field would do is they would just go ahead and max it out, and they would give these people a beautiful blood pressure of like 120, 130, while they're still super tachycardic and while they still have some wound, whether it's internal, wherever they're losing blood from. So all they were doing was encouraging these people to bleed out a lot faster. So yeah, they would get a momentary improvement, and they would get this dramatic.
It's almost like another type of compensated.
And then it's done. You've encouraged that other blood.
Basically,
out.
just, yeah.
And the
Like a
other end of the
mechanic
thing, the other end of the
compensated,
spectrum was the hospital was absolutely notorious for screwing up, because when they came in, you had nurses that didn't know what it was, and they would cut them off. And every
And
single
then they
patient
would
they
kill
cut,
them.
they bottomed
Oh
out the blood
my
pressure, and
God.
they
But it is
killed multiple
cool,
patients
though.
doing that. And so then the state finally said, you know
No.
what, we're not gonna do this anymore, we're
Yeah,
gonna
that
pull away
would
from
kill
mass
them.
trousers. But they do similar things in the hospital and surgery, but you
Can't
don't
take
call
it
it a
off
mass trouser.
before you get blood.
You can call it an inflatable air splint that's used for stabilization, and then you can just over compress it, but yeah, there is still a practical purpose for it, but anyway, so that's something that's out there. So think about not just, I mean, I know we're talking more so about just the vascular access, but these are just things to kind of be thinking about everything as a whole. And I mentioned specific, all that came about because I was just trying to mention that BOA, because it will, in a hypovolemic patient, if they have good vascularity, you can push that blood down a little bit. Other things to think about when we're selecting our vascular access, there is a huge, huge difference just from gravity. If my arm is down here, look at how distended those veins are. I raise my arm up in about 1, 2, it only took 2 seconds, I was gonna count 3, but all of that went away. So, when you've got your patient, yeah, do it, hold your arm down there and give it a good 10 seconds laying with your hand down there. Now roll your hand over the top of your hand.
It's already coming.
Now, raise your hand up and just hold it straight up and count to 3.
That's gonna take less than that, it's already gone.
Yep, that quick. So, when you're starting an IV on your patient in the ambulance, if they're laying down on the stretcher, why do we pick their arm up in the air to start the IV? Drop it down. Yeah, drop it down on the ground. If you're doing it in the hospital and you're having trouble, raise the bed up a little bit.
Yeah.
Rather than putting yourself on the floor, raise the bed up. I'll have a student raise the bed up and pull their chair right up next to it and do it with the arm off. So yeah, so when you guys, if y'all are doing IVs with me, that's how we're gonna do it, is just, you can hang that arm if you have to. Hang your arm down the side, and it forces that blood distally, and then it shows the veins better. So, all these are things that we can do to help us. And I know we talked about, our actual site selection. Now, what does the book say as far as for how you pick where you start your IV?
What does the book say?
So,
Probably wherever you see the vein. I'm on it right now.
well, so that's the practical thing, is wherever you see the vein, but most educational material will tell you to start distal and
Oh,
go
yeah.
proximal.
Yeah.
Because if you blow the
mess
vein
up
here,
you can't really.
you
can't
can't
go
go
down.
lower. So what they say is, oh, start down here. That's anticipating failure. Like, I don't want you to go into this going, you know what, I'm gonna start down here because I'm probably gonna screw up the first few times. And I need to make sure that after I blow their hand and their lower forearm and their upper forearm and their AC, that I can still go some, no. Like, I would much rather you pick what you feel comfortable with. Go with what you can see.
I had to do that yesterday. It was a vein on like a 16-year-old, and I could see it. I was like, I see it. And they was like, why don't you look at something over there? I was like, no. If y'all don't let me poke him, I want to go over there because I see the vein. And I don't think they could see it, but they still like let me do it, and I got it. It was perfect that you do that. It was perfect.
So, the thing,
Yeah, she did, she was.
Couple of
nice.
things
But all, when
we
Joseph was there, the whole
absolutely
time, they
wanna
didn't
pick-
never after shift change.
we wanna pick veins
She's cool.
that we feel confident, we wanna pick one that we say, I can get that. But there's criteria, we shouldn't just go, I see purple, blue, I'm going right there. It's not just about seeing it, we need to think about
How deep
one,
it is, how high it is.
how deep it is,
How wide it is.
how straight, that's gonna be a big
Yeah.
thing. And do we see bumps in it, do we see
Like
valves in it?
yeah.
The other thing is we have to think outside of just the vein itself, but positioning on the patient. So this
Yeah,
area
everything.
right here is the most painful place you could ever start an IV ulcer. I would rather you put one through my knuckle than to put one on that meat right there, because it is so thin and the tendons are right there below it. There's no.
It's so funny that you said it, cause me and the nurse was like racing, like whoever find the vein first, cause two nurses had already stuck this one patient, cause her
Yeah.
veins like stuck. And nobody could get access to it, so me and this other nurse, we was like racing to see which one of us could find the vein. And she found one in the arm right here, and I had found one right outside, I can get it, and she like gave me the thing, she was like, stick it, then I was
And
like, nah,
sometimes-
yours look better.
Sometimes
She
you
got it,
have
though.
to go in here, but
It was
for your
awesome.
patient's comfort. Now, again, if we're looking at medical necessity, comfort, everything else is out the window. But if you guys are going in and it's, especially like we're in a hospital setting and hey, we just need to get an IV to give her some fluids or to give her some medication, well, let's avoid areas, right, especially the real painful ones here. And even this up here tends to be, now, the least painful place you can do an IV is in this part of the arm.
Okay.
Really, the AC is even less than that, but only at the point of sticking. So the trade-off is the AC, yeah, that's great up here.
When they been in that arm,
But once you
it's
put
like-
that here, now that arm is stuck. Now if they bend it, they're occluding it. And if you do it all the way down in the hand, it can be painful, and it kind of takes their hands sometimes out of commission for movement. But something out in here, we can put it and we can just leave it there. Now, again, we get what we can, and necessity is always gonna supersede patient comfort, but in best case scenario, let's look for something. If I've got the choice, I'm gonna go with, hey, I'm gonna do this here, because now you can bend your arm if you need to, because once this is done and we can take this down, you can move that IV around. Also, even if I'm moving the hand, there's not much skin movement, because remember, the needle, the catheter is gonna be going through the skin and through the vein. So where we get a lot of pain sometimes is if the skin is moving on the surface over the rest of the tissue, the underlying tissue, and the vascularity. So in your hand, we can get a lot of that. In here, we can definitely get a lot of that. But here, even if I'm doing this, all
The
that's
skin
pretty
is
much staying stable.
Mhm.
So those are things to think about.
Mhm.
We think about, we've talked about our approach angle, and I'm sure now you guys have actually seen that whole textbook, I'm going 45 and all the way,
No.
yeah. We're going a lot lower, and we're gonna push in, and we're gonna make sure we drop down so that we don't punch through. Well, remember things like with your hand, one of the things that'll make the hand a little bit easier is with the hand, you can truly pull tension and be totally out of the way. So sometimes the hands are easier because, hey, I can pull this, and I can see everything laid out, and I can literally drop that needle almost at a 0-degree angle, as close to it as possible. I say that, but I have seen people actually try to lay the needle on the skin and go in.
Yeah, they don't.
You need at least about 15 degrees, because when they went flat on the skin, I swear I think they were tearing layers of skin apart. I think they was going between the layers for a little bit before they went in. So, yeah, just that 15 degrees is perfect. But, yeah, the hand can be good. One of the benefits if we're doing that is we can actually sometimes pull the vasculature with the skin and hold it tight. Some people will aim for right where something bifurcates, like right where you see a split, because their thought is well, hey, if I go between this one and that one, I can't miss, because I'm gonna go right in the middle of it.
No.
But you see that bump there is the valve, and
You gotta stand that one.
if you look, like that one, yeah, it goes right there, but it'd just be a lot easier to go somewhere with something a little bit straight.
Yeah, if anything, if I was.
Why wouldn't I
to
go
stick
for this
that
one right here?
I would stick it right there.
Exactly. all this, that one is good, that one is good. You don't see it as much, on me right here, but when you've got somebody laying down, a lot of people will have, you can kinda
I can
see
just
it
go
right
dark,
there.
get your arm and get your brain.
That one is on the, if you ever end up having to get somebody and you're doing one like, you're in an odd position and you roll them up, that one across there, just remember that there's one that comes, because that one is one you could get, say you're at the head of the stretcher, and you can pull it up. No, I'm serious, like, you can pull up like that.
I'll
Oh,
just
yeah.
turn the list off.
All that stuff.
You need to send me that video.
I don't have the video.
Joseph has it?
Yeah.
The,
One more, it's not
so,
happening.
I'll tell you right now, you know, be careful when you get, by the time you get into paramedic though.
Hey, man.
You know, we were,
I see one going.
paramedics would do things like sit around and drink and make challenges and bets of who could get an IV where and things like that.
Oh, is that what we're gonna do?
Hospital
I'm
is
fine with doing that if I'm doing it.
Because,
Okay.
and it's like, now, me personally, I've started an IV on my own foot when I've been sick before, because you have two hands in and you can occlude and attach equipment versus I've started them in my arm before, but it's a little harder. But, no, we had competitions with trying to start them on each other. We had one guy that wanted to start one on somebody on their forehead on that little, I didn't like that. They started one on me at the time I was in a lot better shape, and I had one right here, like on the lower part of my abdomen, and they were like, man, we can get that. I was like, all right, I bet you can. And they did. Yeah. The only one I wouldn't let them touch is, I've always had this like big old vein there. I'm like, no, you're not touching that.
No.
You hit that, I was like, I may bleed out or something.
The one on the other side looks better.
Yeah, I told them, you're not touching those.
No.
But, alright, so, one of the things we do have to be conscious out there as well, as we're starting IVs, is we don't just have veins, but what also runs right there with those veins? So arteries are vascular access. However, they're pressurized, and the whole thing is we're trying to induce something through this access point. So we need there is pressure. We know that, because otherwise, like, it's that peripheral vascular pressure that forces the return of blood back to the heart. If there was no pressure in the veins, then we wouldn't get that circulation. However, the ejection force of an artery is much stronger because that is pushing against the resistance of the capillary bed. What's on the other side is the residual, that's just the backflow. So it's a lot easier for us to overcome that pressure with this. Now, things can be given through arteries, but they generally have to be, those are things way beyond us. That's stuff that's more like infusion pumps and things like that. There are times that the hospital will do that. Like, if they want to get true blood gases, they like to get them from the artery side, because we want to get the readouts of what the output in the heart, like the oxygenated blood, things like that. Excuse me. So our thing would be is if you go to start an IV on something and it pulsates, that's an artery.
Yeah.
A vein, you won't get the pulsation, because that's where that ejection force of the heart is pushing. The venous pressure is almost continuously, you don't get that hard push. But trying to think what else on that note for you, because I don't want to get into the different types of solutions other than normal saline. But let me go ahead and, if y'all want to take a break for just a minute, and I'm going to go ahead and log this in, just because I need to look to make sure that we've hit, I want to make sure I hit all the critical stuff that's going to be relative to testing. Provide vacuum. Oh, so while you're here, a couple things. Let me see if I've still got the pulled up in our
So the Tactical Medic Group, one of the guys is a nurse up at Grady, and so he's all the time sending us stuff. Well, there's another doc up there, there's one of the actual docs that works up there in the ER, that one will send pictures of, oh, look at this x-ray, and then somebody else is like, oh, well, look at this x-ray. So,
You got an X-ray trading group?
yes. Attempted suicide by nail gun. He puts the nail gun right here,
Why nail?
but when he pulls the trigger, you have to push to put pressure on it. Well, he puts pressure, and it goes right through there,
Yeah.
fractures his jaw, tears the gums, tears his tongue, and then just ends up embedded in the sinuses.
Duh,
I just wanna
because
know-
they
I was really
are
hoping you were gonna
them.
tell me the whole thing
Duh,
just
the
closed him
bone.
up.
They so dumb.
So he went in there, and his
No,
complaint
yeah.
was of blood in his mouth, jaw pain, and sinus congestion.
That's what he called it in as, like, dude, you got
No, he went in there, he went in himself, but it was like straight into his nasal cavity.
So, quick question, is he still suicidal?
Yeah.
Oh, is that the one from,
No, that is,
And it's so funny because the nurses will be like,
Yeah.
oh,
What's the
duh,
stuff
because they be
around
like
it?
feeling
That's
bad
so
for
good.
themselves. Like,
That
it's
is-
hard,
so
it's
he was
hard.
shot.
Well,
that was and it was a pistol round at extremely close
look at that
range.
stuff. It's so crazy.
And so
So what's that, like a 22 or
9 millimeter.
Yeesh.
That was
That's
a
a break in the
femur. That was 9 millimeter at very close range that did not tear up exterior tissue, but it was a direct shot to the bone.
Wow.
So he sent it because the other guy sent that one. So this guy
I mean, oh,
got
no.
shot, and this was I think this one was a 380. He said.
Oh, that was the arm.
It was a 380, so smaller, but said that this guy was drunk at the time that it happened, and said he got shot, and he didn't realize the bone. I guess he was really drunk and really high, and he thought he could go home and sleep it off. He came in the morning and he said, man, it happened the night before, and he told him, he's like, yeah, I knew I was shot, but I thought I could just go home and sleep it off. And they're like, no, you're not gonna, like, that's.
You're not gonna sleep
you're
that
not
off.
gonna sleep that off.
Your
They said
bones don't
they said
connect,
they
man.
grabbed and they moved, when they went to look at the wound, they grabbed his elbow, and he said everything moved independently, and they were like, oh,
wow.
stop.
Oh, God damn it. Oh, wow. I know they heard it crap for this. It just.
Alright, I don't think you really need an X-ray on what
Oh,
happened,
I
man.
know.
What happened then?
Yeah. He was feeding it through a table saw.
That explains that nice clean cut, though.
Yes.
Yeah.
But about the time it went cut, there started to be a reaction, so
Yeah.
that's why
See
we
it
got the,
in
yep,
TV.
it was like,
Took 3 fingers deeper to realize he's cutting them off.
3 fingers?
Yeah.
That's a little upsetting.
Yeah. Miss Jones.
I know what those are.
and
Oh.
Yeesh.
That's why you don't cheat on your baby mama.
no, that one,
Oh, no, he probably
no,
fed.
that was,
How he got that eye in his eye? Don't look like he's going up or down. They just like.
He was sleeping.
He was sleeping.
no, he was,
Sleep with one eye open.
fighting somebody.
Yeah, they got another level 1, level 2
Sleep with
course.
one eye
I found out,
open.
'cause when I checked, they only had the level 2
No.
involved.
So that level 2 is a combination.
Oh, it's a
level
combo
1
one
and
and
level
one.
2.
Okay.
Yep. And there is, so that's the one in,
How long is that?
that's the one that is October 25th through 29th.
Yeah.
But it's like, early in the morning, so depending on where you're driving from, you probably want to go down on the 24th. But,
Are you
but
doing
yeah, that's
clinicals
gonna
in the
be
morning?
Monday through Friday. This
Only a
week,
week long worth of training?
this week, no. My clinicals are next week on Monday and Wednesday.
Okay, so I'll
So
be
it's
with you
only-
on Monday and
It's
Wednesday.
only a week long?
Wait, no, I'll be with you on
Yes.
Monday.
So we've cut all of the fat out of everything.
Must be
This
fine.
course, there it is.
What? Who are
So
doing
I've gotta be
clinicals
there,
with
we
us?
are setting things up that day.
Is Gary
The
doing
jaw
clinicals
wouldn't
with us?
start until that morning.
So I'll do it right
But
now.
Monday you
Melissa, I know
start out,
she
Monday
does,
is classroom, but you finish every bit of classroom by lunchtime on Monday.
Okay, and then after that, it's just scenarios.
So that afternoon, you'll actually start doing drills. So you cover what used to
Is
be
there a place for me to
3-day
stay there, or I
course.
have to go find a?
There's hotels, we've got information put together on like where you wanna stay, where you don't wanna stay. And then what we try and do is when it comes up, is we try to put everybody in contact with each other. And so it's like, hey, everybody kind of bounces back and forth, and like, hey, does somebody want to split a room? Or this last class, we actually had somebody who said, hey, because the modules take place, the other way we've been able to trim it down is we have dedicated places we go to each day. Sometimes, like most everybody stayed and based out of one area, but for one of the days, we had a guy that's like, hey, I live in this area, anybody's welcome to come and crash at my house. Like, so the folks in the class communicate with each other
Where is
in the
this?
weeks before. So you start out in Dougherty County at the Albany EMS station. That's where they'll do that one. And like I say, you'll do classroom, and then you'll do team movement drills on Monday. You'll actually be running through, and you'll cover everything for level 1 in one day now. It used to be a 3-day course, but we cram it in. It's a lot of stuff, and we actually send you stuff ahead of time for you to read and learn, and that way you're kind of committed. We just fill in the gaps. But we'll start working on by so Tuesday you'll move into, we'll actually do like weapon retention drills. There'll be a lot more weapon drills. There'll be team movement drills. We'll cover areas of responsibility. You'll do a lot of room clearing, but we start bringing in the simunition rounds and things like that. Well, we've moved to the airsoft, but there's 6mm 25-gram propane powered airsoffts. So yeah.
Got a little dip to it, don't it?
Then Wednesday is awesome. Wednesday you go to whatchamacallit, I can't remember. It's an abandoned Marine base, but it's their whole housing area. So there's apartments, houses, a PX, all that stuff, and you do an entire day of road crossings, building clearings, and it's like you'll clear a house, clear the next house, clear the next house. Then we actually will put the teams, we'll trade out, and we'll have like somebody being bad guys in the house, and you're going through, and we do actual fire with the airsoffts through there. But you spend that entire day running drills through there. Now, the other way we cut down on time is lunches, we stop and you eat right where you are, so like you bring a lunch every day.
Okay.
So what we started doing was, by day 2, I started bringing a grill, and I told everybody, just look, I'm bringing a grill. We cooked hot dogs one day, we did peanut butter and jellies one day, but again, everybody kind of threw in $3 and I bought lunch and we cooked lunch. But Wednesday is nothing but doing all that stuff in the housing. Thursday is range day. It'll be all dynamic shooting. You'll start out and you will do.
Start out static and then move towards moving.
Yeah, then you'll move to dynamic. You'll start out static in the morning, and then you'll move to dynamic shooting exercises very quickly. They'll do a lot of stress shooting scenarios, like moving forwards, backwards, side. We'll do dynamic ones where you're moving down the line and we're calling out different targets and you're engaging them. We talk about just some of the different ballistics advantages and why picking different weapon systems over other ones. But Friday is woodland ops. Friday is nothing but you report to a whole different area, and you spend the morning going over movements, extractions, things like that relative to woodland ops. There's a lot of the planning of which, realistically, if you down here in the South, if it's anybody with any kind of hunting, woods, if you're going after them in their element, you just don't go. You call and let GSP come in with a clear helicopter and look at them from
And then
way far away.
blast it down, yeah.
So, but by the afternoon, you start running scenarios. You're going to be doing movements through the woods, and then the final thing is we actually have a thing where you go out and you have an incident and you get an injured officer, and then you have to extract them out of the woods. And then we do like the little graduation stuff and all that. But
That's end of October, pretty
Mhm.
much.
but
Just trying to plan everything.
we're going to be having to add another class just because we've got too many people. So.
Already signed up too many?
So the class got full, but what we've done is we've opened it because what we're doing is we're gonna have to just run a second class. So we're looking at somewhere, potentially
we thought there, but then that fell with Thanksgiving, so we're trying to figure out when we can potentially run a second class right around that same area. But there's a 2-week one there, so you can't do it right there.
2 week class, what's that?
That's what I'm going and attending. It's stuff for the state. Excuse me. The first week is some prereq stuff, but then, the plan is if I can pass the first week, then I wanna do SWAT school. Sniper school. So I'm
Like,
trying
aren't you
to.
already finished the SWAT stuff?
Yeah, it's sniper school, so I would really, really like to do that. Of course, I gotta get weapons system built before I can do that.
Is there anything I should have, like any weapon system I should take?
We'll send out a list ahead of time, but all the stuff that you'll be doing, that's your preference. Most everybody was running 9mm or 40. We'll only be doing pistol work on the range. That's everything we'll be focused on will be just pistol work. We do cover long guns for movement interior, so bring a long gun, but you don't have to bring ammunition for long gun. If you don't have a long gun, it's no big deal because most of the stuff we're going to be doing with that is all going to be run with airsoft anyway. When you do your target stuff, your weapon retention stuff, all your movement drills are all going to run with your own weapon system. We will provide the airsoft blocks while you're actually running any of the live fire drills, and then when you go to range, of course, you're using whatever you choose to use. But
You don't supply ammunition, or I gotta find out?
no, we don't supply it, but we do look to. But we don't supply that. But what we do is we look around and we try to find like who you can outsource through, who's got the best deals, things like that, and we provide that information of hey, if you're looking for it. And then what we've done in the past is if somebody doesn't have any, is we will, if we can find a really good deal, we'll purchase it in bulk and then just have it there. You give us a heads up like, hey, I wasn't able to get it, cool, no problem. We've got it, this is what we paid for it, here you go, give it your all. I ended up I traded, there was a guy that came up there with 40 and then he wanted to run somebody else's gun through some of the training. And so I traded him a bunch of 9mm.
I wonder if Joseph already.
And we made sure,
You
like,
know,
we're gonna make sure that
photo
everybody's
shop.
Oh, yeah, I know
squared
that.
away.
We was at
And
Christmas
that's one thing. And
together.
everything that we did, there was a lot of effort amongst the team. Like people making sure people got stuff squared away, people saying, hey, I found this. There was communication in the weeks beforehand of folks saying, hey, guess what, guys, I found this ammunition for this price. Does anybody need it? Or I'm buying it and paying the shipping anyway. Does anybody want anything else on this order? Yeah. So everybody seemed to communicate really well through there. Dang it, what is let's try this one. Pass. Hey, at least it's right. I don't care if it's expired.
The 23rd. Yeah, mine's on the 23rd next week. Yeah,
Is it Monday or Wednesday?
that's a Wednesday. Cause I only have
It's the night one, isn't it? Or-
yeah, Virginia 7 p to 7 a.m. all over again.
Sleep on
Hey, so,
Wednesday.
clarify that to me. So the one on the 21st, is that daytime or nighttime?
23rd.
21st is in the
Monday
day.
one I don't know.
Okay, so
It's
Monday
7
one is.
a.m. to 7 p.m.
If my name's on it, it's a night one.
Alright, so Monday.
Yeah, I think I have
let me-
on that ones too.
I'm gonna go on with mine.
I
just
should have
for
done the day one on that.
Alright, and so the one on the 23rd, that's the one we're doing the 7 p.m. one, right?
That's
Yeah,
7 p 7 a.m.
7 p.
And then we're back here on Thursday.
Yep.
Which, I will tell you, we will not be there till 7 a.m.
We weren't last
We
time
weren't
either.
there
I
last
think
time 'cause me
we
and
were
Mom
there
were
for a total.
sleeping.
Yeah, we were there until 5.
5.
And then he was like, "Yeah, it's dead. There's no point of us being here. Let's just call it a night." And I think the only person who got some good sleep before they got there was Joseph.
Yeah, yeah. Me and you were the only ones that didn't get sleep.
I rolled in.
Maybe got like 2 hours of sleep.
Yeah, I rolled in with a strong 0 hours. I slammed 2 Red Bull. He was like, "Go get some sleep." I'm trying. I gotta go to work. I'm at work. It won't leave me alone. Get some water. So I can
Where
go
y'all
on
got
there.
to see that? Did y'all get to go in the chill room that
Yeah.
you got back there?
Yep, we got to sit there.
Not in the ATM, I'm talking like in the, not in the
You know where we
EMT room.
dropped? No. What else?
It's another room they got back there with chairs, the TV.
Nah, there's a picture
They got
somewhere. Joseph has it,
refrigerators.
but Hannah's kicked back, and I'm like this right here.
I
and
saw
I'm
mine,
just-
he was all curled up, he started snoring, and I was like, fuck, man, I'm tired. And then I started watching the TV, and before I
Yeah,
knew
the
it,
game. I
I
already
was
saw that game, so I was like, this isn't interesting, and I couldn't.
They
find
turned
it.
the, they turned the sound on.
No, they did not
No.
turn the sound on, which
Why
is very
you
upsetting.
And we couldn't change the channel or anything.
There's no remote.
Oh,
Yeah, it's on the bottom, you just go to the bottom of the TV, there's a circle and there's a center button.
Yeah.
And pushing it back and forth and then side to side gives you like volume and channel up and channel down. And
There's no
Wednesday,
volume,
we
but
changed
it's-
that channel on Wednesday.
No, we're not. It's the NBA Finals, bro.
Nobody
The
listens
Hawks
to
have a
that.
chance to go to the Eastern Conference Finals. You know
You're
the last
literally
time.
the only one that gives a shit.
You know the last time the Hawks went to the Eastern
No,
Conference
I don't,
Finals?
because I don't watch it.
None of us were alive. None of
So
us
why
were
is it
alive.
relevant?
Because,
so what you're saying is they've sucked for a really long time.
Exactly.
yeah. But that year they also won their championship, so I mean, maybe they'll do it again this time.
Hey, I mean, nobody's watching the Braves right now, so you gotta find something better.
Yeah, the Braves suck. There's I don't know how the United is doing. The Falcons don't exist.
They're dead.
They got rid of Julio. They're losing Julio Jones. I was like, I met Julio. Cool dude. Very good.
Ace map is ridiculous.
What you want to ask me for?
I'm sitting here, I'm trying to check to see what days I have clinicals, because I honestly don't even remember. And
They
it's
posted
like,
it wrong.
oh, you didn't do this, you left early, you have to do this, and you have to like next to 15,000 times and half the time it doesn't register.
Come on, Ace.
Yeah.
I didn't even look at my ace map stuff. I know you sent me some messages and it was like, you're in rotation, but that's all I could see just from the outside of the
Yeah.
message. I didn't even look on the inside. I gotta do better. I need a phone just for my school stuff.
How do you even go to look to see what rotation you're in?
He sent you an email to either your personal email or your school email, and it'll say you are in rotation. Ace left.
Well,
you
I
are in
know, but
rotation.
I'm just like to try and pull it up on here.
Which book is this one?
This orange.
Yeah,
but it's-
the
Advanced emergency care and
That's
transfer.
right. That's why I can't find it, because he changed y'all's book last minute. I forgot.
I hope you don't have it.
Well, all I'm doing is I'm just looking to make sure I don't miss any. Like, I wanna make sure I cover anything that you guys are gonna be tested on, but all I plan on doing is looking at it, and then I'm gonna sit down and we're gonna talk through stuff like we just did, and then.
Yeah, cause we
We're gonna
read
flip
it,
through-
the like,
Yeah,
slide 50 or something, maybe? I don't remember.
yeah, we're gonna flip through all those. Oh, we're gonna play with the, we're gonna pull some videos of SMIOs, and then we're going to, play with the actual ones, but I was trying to see.
Are there any mannequins we can actually practice with?
Yes.
For items?
It's ghetto. It's like working 5 days a week.
I'd be good with only working 5 days a week.
Damn.
So this is the AAOS, but this is, and what, y'all are on chapter,
13.
so this is their basic one, then, this is not the, so I'm gonna pull up whatever I have, just to flip through something. So I don't have a label telling me which PowerPoint is what.
Did they ever load it?
Yeah, I'm just, so I'm actually looking for something different than y'all's. Cause you've got, y'all have access to your PowerPoints, right?
Yes.
So there's no need for me to sit here and. But I wonder why they're not. If I don't see what I'm looking for, we're just gonna move on to something different. Yep, I don't care, we're gonna move on. So we will go over some of that, I'm gonna flip through your book in just a second, but I wanna find what I was telling you about the, sorry, browser. I guess this is a browser. I got rid of my Google Chrome.
Whack.
Yeah, I guess they don't like that. And this is so slow. Let me see. There we go.
Hey, do you drive a Yamaha?
I do.
Do you know the V-Stars? Do you know what size that is? Is that like a Sportster or is that a little big?
I don't know.
So I'm looking at this one only for 25 and it says he only has 18,000 miles on 03.
It's what, which model?
A Yamaha with a 650. He did some work on it, made it a bobber, but it looks good.
No. Not bad little bike.
Yeah, I just don't know what size it is. I'm thinking about it.
So mine is a 700 and I'm very happy with it. Now granted, the weight on my bike weighs about 50 pounds less than an Ninja 650. The wet weight on mine is like 320 something pounds.
Oh, that ain't
Or
shit.
40 pounds, but it's, yeah. You know what? Let me, this is great.
Sexually hungry.
Where's the sound?
How did he not flinch?
Hell nah.
How do I get to my volume?
What about the video?
Video volume's all the way up.
That speaker is on. So what is it?
Maybe there's not
I was
volume.
gonna say maybe he's not even saying video.
I can't look at it.
Can't imagine they're not doing.
And he didn't even flinch.
So
That's how I take IVs.
let's go back. We'll just go back and start.
We all know that.
I got video of me saying otherwise.
What, sitting still and cooperating?
Yeah. It was one video, and after that I was traumatized. Oh, he's just trying his best. You can tell he's just like, man.
He didn't flinch at all.
Yeah, because
Yeah,
the whole thing
he
is like,
normal.
alright, we're trying to promote this and we're trying to say that this is a.
Oh, he's under tons of drugs. That's what it is. All the drugs. You would have to have me just all kinds of drugged up to do this.
I feel like pushing the fluid in would hurt too.
Yeah. Or some kind of pressure.
I meant like my sternum hurts watching that.
Yeah, I was just about.
It doesn't hurt, liars. So if we push normal saline into an IO, would it help push blood out, or no? Because I know marrow is in the bones, and marrow helps with. Yeah, that's what I'm thinking. I know.
So it's vasculature, there's still circulation there, so it's not like the saline would force the blood out and then remain in there. It's going to mix and it's going to introduce into the circulatory system.
Yeah, increase the volume.
But,
Okay.
let's see if we can, I want to find these.
It's not really warm. Really, really good.
Let's see what you guys are available. See, I wanted to find,
Dr. Josie behind that.
It is identical to the hot.
so I guess they're blocking certain videos. Well, let's see if we can find a, oh, well, that's not what I want to do.
Affordable Care Act stays. 7-2 vote.
Do what?
Before Obamacare stays.
Oh.
This is the third time they tried.
I wanted to find it. I wanted to find one on an actual. Why does the volume work on certain ones and not on others? Oh, there it goes.
Okay, Tim, thanks for lending us your leg today to demonstrate the beak, the bone injection gun. No problem. Maybe first we'll just pop some Benadryl on here to sterilise the skin. Okay, so we've got an adult size big bone injection gun that we're going to use for us. We've already sterilised the skin. Next thing we're going to do is to locate the site that we want. So I'm going to go down there. midline of the tibia, and the feel for the tibial tuberosity, which is very easy to feel there. In a couple of fingers, an upper finger, so that's actually the triggering site. Pop that on there for you. So Tim, that's where I'm going to access your intravascular space. Going to remove the safety catch. Place my palm and press firmly down and slide it across. You get a close-up shot of Tim's face just to watch for the tears. And gently take that off. And there it is. Nicely. I've got a simple flexibilizing connector which I'm going to put on there and remove the sentries.
Like you said, the camera panned away so they don't show him crying.
There we go, Tim. Doesn't look like one, but you've got a nice robust IV access there. I want to do everything that's in the manual. I can then stabilize it with the
Alright.
stabilizing.
And then he needs to aspirate back on it, he needs to pull back.
So I'm going from there, but hopefully I don't hurt you too much. You'll find that's actually really rather robust. Now everybody says, I can't do that, it's going to hurt. Did that hurt? No. I've been told it feels no worse than doing that. Is that true?
It was a mild to moderate thump.
Just a thing. Yeah.
I would never have believed that was a knee injury.
And that's what brings up remarkably old pain.
Oh, great,
Very
man.
secure way to IV access. Thanks very much, Tim. You can go.
Thank you. It was right clunky.
All right. And the only other one is I want to do, EZIO drill. EZIO drill. There we go.
Hello, this is the quick hit on the EZIO insertion. Here's the basic equipment you're going to need. I want to highlight the 45 millimeter needle, the yellow one, is the needle of choice for your proximal humerus insertion in any patient that's a code within the hospital. When locating proximal humerus site of insertion, remember you're looking for the greater tubercle, the surgical neck of that bone, which you can feel as it comes up the shoulder. And you want to go approximately 2 centimeters above it. Your insertion of your needle is a 45-degree angle. Remember that the reference point is you're going to aim at the opposite hip. So I've located my landmark for insertion.
So, I
in the
don't
proximal
like-
hum-
I like that, so I haven't heard them say the thing about aiming at the hip. I've always heard about degrees of angle and things like that, but that's an easy landmark to just say that we should be pointed towards the opposite hip. That's like a nice, easy reference, I think.
I heard somebody say that.
I like that.
humerus location. I'm at a 45-degree angle to the patient's opposite hip.
Oh, he's not
Insert the
actually.
needle. And then I'm going to hook up my EZIO
Yeah,
connector.
you suck, we don't want you.
Once that's
I wanna see an actual, we want an actual insertion.
He look like he might do it.
This guy, there we go.
Alright, we get ready. I'd say this is like the TV show Quincy, but not even
Yep, see, you can count on firemen to do dumb stuff.
That sounds great.
Zero less than villain.
Oh.
Yeah, they are straight up just doing this in their dorm room.
He's got anything that's over for him, right? Made a great question.
Kiss my ass. I would never do that shit.
No.
Right before you stick it in.
Whoa.
It's not the first time you said that.
Look at him looking at the phone, that's in the one right there, we call it the,
Are you doing a selfie?
The IO
Oh,
side.
no, that ain't the one right there.
Remember, it's gonna be like down in that.
What's going on?
Oh, wow.
Come on, stop. I was about to say.
Do you even know where you aiming at?
Jump right in, put it in the right direction.
Sure, why not? How bad can it be? Easy IO training. Are you fucking kidding me? Firefighters.
You can get 117 where you're going.
Oh my god.
They didn't even find where they were.
Can we just fast forward to see if he did it right or wrong?
No.
No.
No, I want to watch the build up. We need the build up. Don't just skip the foreplay. My bad, Joseph.
Come on, pull the trigger. Do it.
You're gonna press down before you pull. Press down.
He's like, if they don't shut up, you just go already.
That was it?
That's it? No. Damn.
He looks angry.
Why they messing with him too? Like,
Why they
asshole?
stop
do
in the
it, no?
middle? Just do it.
Why they going slow?
No, it just feels weird. Like it feels real weird. So far, it hasn't really been painful.
Oh, there it is. Oh no. Oh no. Oh no. No.
Do not do this. When you do it, you
You go all the way.
push through the skin until you hit bone,
If
and
I have
then
to
you
do it,
pull
I'll
the
do
trigger and push down hard.
If I have to do it, I just stop watching this.
When you drill down to the hub?
Okay.
Yes, you have to bury it to the hub. The plastic needs to be flat on the skin.
Still do it.
I think Rob's.
Do the goddamn thing.
They're terrible.
We're talking about what not to do.
Oh, and
Oh,
they
that's
go a
what
little
we
bit at a
studied.
time.
Oh,
What
we
is wrong with
studied
them?
what's not to do. Oh.
Still down. There it is. Alright. Holy shit, look at it drop.
Yeah, that's a little thing.
Alright, so now, when I take off this, you don't know how it's not under pressure.
Y'all talking some goddamn much right
So
here.
when you pull, it's a magnet connection that holds it on.
Okay?
It just separates. There you go.
Style it.
And then the cap is
Yes.
also.
You're gonna walk in?
Are you serious?
Oh, then we have to kick my ass.
Sorry, I'm staying.
I was over there, they all owe me lunch.
Take a couple nice deep breaths.
Yeah, all that is like,
Ooh.
why are you, why are you?
It's in the cap, I think, prior to it pulling it up. Watch this stylet on the.
They can't say he got no big balls.
Get it out.
Oh, ooh.
Oh,
Does it hurt you, Rob?
No, it's
Look
just,
at- look at his heart rate.
I was just about to say,
43.
you just might
42.
pass out.
Yeah. He's struggling. So he's having a vagal response right now.
Uh-huh.
The pain is causing his heart rate to drop. And it eventually could cause him to pass out. That's the cardiac monitor, so he had to get below 40.
Cool.
Everybody was done.
Oh, he
Yeah.
picked up
Do you see
136.
it? Somebody give me a spot.
Oh, too slow now.
Yeah, but look, it's all artifact. The
Oh,
the
yeah.
underlying, that underlying rhythm,
Uh-huh.
Remove. Sure.
What was I gonna say?
the underlying
Oh,
rhythm
advise
is in the 30s.
Stop.
Because that's a 6-second strip and there was only 3 beats on there.
Wow.
So we multiply it by
Nice deep
10.
breaths.
Take it out right now? You want to
Stop
stick it out? or you
and
want
buy. Please,
You want to
clear
stick it
the
out?
patient.
Spit it out. You want to do it?
Yeah.
Turn this on.
Yeah.
Yeah, so all of that is tremors. It's giving him that artifact. You look at the vascular, the ventricular response,
Turn it on.
Okay.
Pull it out.
and the ventricular response, he was down in his 30s. Mm,
Okay, so how we gonna take this out?
Yeah, you're watching it.
that's how you take it out.
There it is.
Put pressure on the, there you go.
Doesn't look like it's good. Done?
Sure, why not? How bad can it be
Oh,
that
no, bleed, okay.
We got a call if you wanna come or.
bad?
And then he been an
Wow.
asshole.
We got a call if you want to go. Come hang out, have a good time.
That was,
Hurt or what?
wow. All right, so,
The heart of the.
yeah.
Alright, so, just like we did, IV practice on each other, who's ready for IO practice?
Fuck out of here.
You're like, I quit, I'm gonna go do something else.
All right, that sounds like a good reason to go become a welder.
Nah, I don't quit, but I can do it
Well
on you.
played. I heard you.
No, I wouldn't quit, I just do it on you.
No, welders do dumb
Right.
shit at work too.
I was not very happy.
I'm married to one. I hear all the stupid shit.
Yeah, but they're not trying to weld each other's butt cheeks closed.
Yeah, close. They do dumb shit. They
Just
do.
saying, that's how I feel like would be as painful as that IO.
That,
No,
so,
they like to
a
bring
lot
problem
of that
better.
too, I think had to do with,
Just
How's that feel?
Yeah.
How's that feel?
and then, yeah, and they finally, there it went.
Oh my god, I would be fighting anyone with the IO in. I don't care.
I would like lay down for the whole shift and be like, y'all motherfuckers owe me. I'm
Yeah,
not
right.
doing
I'm
shit.
going home.
No,
I'll be
I'm
like-
gonna stay at work.
Like,
No, I'm gonna
collect a
stay
check
at
now.
work. But I'm gonna lay down.
So that's what we're practicing on?
Yep.
Okay.
Where do y'all wanna, let's see this? Uh-oh,
Show me.
we'll do it right here, this'll work.
Man, Joseph's gonna be so mad that he missed today.
He sure is. You know, he wants to be big old evidence right now.
Yeah, I got used to the X form, I got Tylenol. That's all right. We're gonna get our things out. Let's look through and see in the front. There's a bonus here. I'd like to have both of them out. I want you guys to get to, I want y'all to practice with, we're gonna use the spring-loaded bone injection gun, but we're also gonna use the drills. Ooh,
There we go.
we
Perfect.
got one of the old handheld ones too.
So that's the one you were talking
No,
about?
so this is a smaller, so this one,
Logan showed me one that looked like this plunger right here, and he was just like,
yeah,
so
that's
you're
the
gonna come in,
spring-loaded one.
and you're just gonna be right here, and he said just, pow.
Well,
I said right
so
on the
instead of slamming on it, because when you slam it, you can kind of get displaced. Me personally, I would hold, and then you just push down on it like it's real hard, but, right.
Should've came to class. Hell.
I found where I did it.
You found it?
Alright, we've got one attachment. Alright, so all we have are the pediatric ones here, but we're still gonna, we're gonna do it anyway. Alright. Use that one, this one. I don't know what they've done with the others. I hate they did, I hope they didn't throw them away or something, but.
So what are we doing for lunch, guys?
I don't know why I feel like I want to eat rice.
Like after watching that, I figured somebody said they wanted like fried chicken right off the bone. Alright, if we
I
don't,
think I'm gonna, hibachi.
if we don't see one.
Thinking about just getting like rice and chicken. Like, I don't know, like hibachi or something.
Our place is open.
There are a bunch of Thai places open for lunch, it's just they're not close to here.
It's one right there, but I never ate it yet.
I don't know.
It's like, as soon as you turn right, it's one like a half a mile down.
Where at?
A top, right down.
So like, I'm turning, hold on, so I
When you
turn.
turn out from the school, you
So I
turn
get,
right.
I'm exiting from the parking lot, I'm over on that side, then I turn left or right, then I turn.
Turn right.
So I turn right?
And go down, and it's gonna be on the
Oh,
right hand
okay.
side, so top place.
Yeah, I'll try it, I'll try it. I'll just load up on chicken. Oops, my bad. Oh, that's you, okay.
Alright, well, I don't wanna spend a whole lot of time hunting, so we'll just,
Work with what we
we'll
got?
just run with what we got. But we'll talk about the,
I don't know that
the
you're
others.
right there.
Since there's no telling what they did with them.
Hannah,
I'll
Thai
call you
food?
when I leave school, okay?
Hannah, you got the
Alright.
Thai? The hot place right around the corner.
Oh, yeah. Yeah.
I guess, shit.
This counts for you sticking me. There you go.
I
It's
guess
safe.
I'll, I guess.
Oh, yeah, I
You,
didn't
they can tell you I'm
Did
not
I
a fun.
stick
No, I'm not a fun stick. Not a fun stick.
Alright, so just
I'm
so we
hungry, but
know,
one good
there
one after
are,
that.
there are the larger ones out there, and the spring-loaded ones. So this one right here, this is gonna, like, that would be fine for a little baby, but that's gonna be about it. That's the only thing that was gonna do. So this company makes some in several different sizes, that's why that big thing is there. These work, but these, you know, they don't have that good handle. They're not like the big T handle, they're not like the doorknob. They're a lot more difficult to work with, but they were cheaper, so some people buy these. I don't see these in the field anymore, ever. In fact, it's been years since I've seen one of those. The bone injection gun is still pretty common. If I had thought we were doing this today, I'd brought one up for y'all.
We can rush
But
over to M3. They don't
the,
use this stuff.
But with it, the idea is it's gonna, you saw in there, it's got the pin that you'll pull out for the safety, but when that one is placed, that one you physically, like there'll be a large area at the bottom that you can hold it however, but have it stabilized, and then the top, when you push down, once it passes a certain point, it's kind of like an auto injection pin.
Okay.
It spring loads and it fires in, but you need to have force behind it so that it doesn't push back. Because mine, when it fired, like I wasn't holding here, I was like, oh, okay, I'm just gonna push it, and it went bink and pushed me out. So with these are gonna be a lot different. Now, again, what we're running with here, that is the tiny little pediatric needle. That's what that is for. So not only do they not have any of the regular needles, they don't have any of the larger size needles. So, you know, what we've got, you're never going to get the penetration depth that we truly need for this, but
Should the hose be here?
Yeah.
that's all the contact points that
I thought we were supposed to feel for the top of the bone. and then-
don't wanna go in the top of the bone.
With other stuff in the way.
Yeah, so we don't wanna go in the top of the bone.
So we
There's
feel the
connective
top of
tissue
the
and all
bone
that.
and then go
We
down.
feel the top of the bone,
Oh, okay.
and
Go
so
two
then we
fingers.
kinda, we feel the top of it, we say, okay, everything's there, so that's where.
Okay.
I mean, go look at Jefferson.
Can
you'll
you
see.
do mine and tell me where it would be?
Sure.
You
didn't even-
Shane, you
Late
think about
response.
it.
She was like,
So, right here, that's the top of the bone, and so it's like, we can feel as it comes out, but right there is more so the flat part. So then we hit the curve. Right there, so it's flat, curve. So me, what I do is I lay one finger on, and I have two fingers come down, and
Oh,
so.
I felt the groove, okay.
Yeah,
You
like
do
I feel my finger kind of into that groove. So it's pulling, kind of doing that.
three.
Yep, and so then I'm like, okay, this is where I need to be, so right
Oh,
here.
right.
So when it's two fingers down, but I come to where my finger lies, and that gives me, 'cause I can feel that.
I feel that.
Yeah.
Oh, yeah.
See, like you feel, that's not it. Then
There
you
we
feel
go.
this lip, and then you're like, okay.
Okay, so that's where you,
Nope, so there
this
it
is the bone, so then I
Right
go
here?
down here.
Yeah, feel how there's like a
So
gap.
right here.
So there's not
the gap.
not this bone, then there's this. So that gap is that right there.
Okay.
So
So
it
you're
would be
feeling that
this.
bone and that bone. So that's that bone there and then the gap. So then what I do is put one finger in the gap and then 1, 2,
Oh,
and you're gonna be
that's
right
fine.
on that. So you feel
So
where
you
like
go here.
right where the bone is against the skin.
Yes. Okay.
Okay.
So I'm gonna do it on here
Yeah.
and you tell me do I get it right?
A little meaty.
Juicy.
Yeah. I like to eat. What you mean?
Okay, let me see.
Well, what you trying to say? Am I scrawny? Damn.
No,
Yeah.
you're like perfect size. Okay. You got bones in here?
So same
Okay,
thing.
boom.
So it's a little
So
yeah.
it is.
So we find you have to push down, but see
Oh,
that's
that's the groove. Okay,
Yep,
that's
so
the
you feel
groove.
that groove.
Oh,
So
And then,
yep. And so
and then
that's
it's kinda
it.
like right there.
So with
Is
him,
this
found
it?
the groove, 2 fingers, and then kinda, so with that one, because it's so much smaller, I went right where my finger was. He's bigger, so
Go
find the
down a little
groove,
bit.
2 fingers, and you can feel the Now, it's in there, but
Okay.
once you find that, cause if you
It's
hit
more
the
center
groove,
too.
yeah, if you
Okay.
hit the, there you go. So if you hit that, now,
I got a little more.
you can do that to find the groove and then push the arm down.
Okay.
But, you know, that way when you're coming down, so if I've got that right there,
Yeah, that's from I use a really bad leg calf race machine, and you know the ones where they had the cracked leather. Yeah, Body Evolution, man.
it wasn't to the point they're wrapping duct tape around it.
No. I think they actually put a sleeve on it, so to cover up the already bad part.
Okay, so.
If you go look at that equipment, I think
that's
it's
where
like
it goes.
50-year-old equipment.
That's where it goes?
Yep, you can feel bone there. I'm not gonna push too deep, but I mean, yeah, so, that's why you saw they used the yellow, so there's a lot more tissue to go through there. So, the yellow one, you can use on people that are overweight, down on their tibia, but it's designed to go through, because there's a lot more, you're a lot more prone to having more muscle up here, so
Yeah.
we really need to be using those yellows. This one, this red one is for nothing but a little kid down here, so,
Let me see if I
Fine,
can
I
find
do
it.
you see where's the little baby?
This how I found it. I'm doing
leg
it.
one? I don't see, but anyway,
It's right here. Did I get it right?
I got it.
Also have a bump from a shot, so.
Yeah, I still have my
There's that
bruise
right
from my
there.
COVID
One,
shot.
two, yeah. So it's deep down in
I
there,
still
but
got my
yeah.
bruise from
So
the COVID shot.
that gives us our idea area.
It's
And
right.
the biggest thing is coming from, because we know we're there, we know we're down, and then remember, we're aiming for that other hip.
Right.
So depending on which service you go to work for is whether they prefer for you to,
So I'd be right here.
like Columbus says if you're gonna do an IO, well, so put your hand there, point your angle again, there you go. That's the better. So the Columbus wants you to go here first, but I think community recommends here first. And it's based on, they each are saying, oh, we're basing it on our data, the data that says this is a better absorption.
Wouldn't it be better in the leg where most of your vasculature makes blood and stuff?
My thought is yes, because it's a,
That makes sense.
but their thought, the thought process here is, because with this, we're getting all the way down to the tibia, so even though it's a larger bone,
per se.
or longer bone, I guess this is more central, and it's at the head of one of your larger single bones versus
Yeah.
down there. So I get it, I get the data behind this, but the other thing is that I think people have a better success down here just because it's so much closer to the surface. So with
Yeah.
this, we know that we can come down, that we can say, okay, there's the top of the bone right there, and you can come in, there is plenty of flat, and the bone is right there. Like, you're not gonna miss that.
No, you're not.
And it doesn't take a lot of depth for that needle to get through this. I mean, even on that, it's right there, but yet you would need to get deep enough into the bone. It's not just hitting the surface on there, we
Yeah.
need to get deep into it, so that's why we would need those blue needles. But up here, there's so much more tissue, and if people don't use the right size needle, now if you've got the appropriate needle, success is great here, absorption is great here, but people tend to I've seen people use the blue ones and they don't get deep enough.
Yeah.
And so then when they're doing it, they're just forcing whatever they're pushing in, because they don't aspirate back. Now, if you pull back and you don't get blood, you're not where you need to be. So, but they'll do that, and then they'll just push stuff anyway, and they're just pushing it into the muscle and tissue. And
Yeah,
that's similar to
that just
IM.
hurts, yeah.
Yes,
So right here is where I would do it.
yeah, if not given away by them. previous.
I was trying not to look at poles and just go by feel.
Yeah, I know.
So I'd go right here, 'cause that'd be about where the
Right, so the only thing is we want to kind of hit it as straight, so even that you've got the downward angle right, but look straight up above, because right now, no, I mean, as far as so let me stand right where you are, and you stand. So your angle, were pointed in, we need to be straight into the
straight.
bone.
Okay, so straight.
Now,
and
this
then my
mannequin is not, I mean, it's just awkward here. But the idea is that we need to be going straight into the bone. So, I mean, down at your hip, etc. So the pointed down to the hip there would be fine, directional wise, but this shoulder is pushed forward. So ideally, we need to consider the position of this mannequin. Realistically, this person's probably not gonna have their shoulder curled forward like this. They're probably gonna have their shoulder straight. Because nobody's gonna sit like this while you're doing
So
something.
it's almost like the inside of the pelvic part of the hip that you're aiming for.
Well, you're aiming, yeah, the hip angle is for this degree of
Yes.
angle.
Yeah.
But when you come in here, you just wanna make sure that you're going directly into the bone versus, because we need that depth. And so a straight line is gonna be the shortest route there. So we're already needing to use a longer needle. If we go at an angle, we increase our distance we gotta travel.
Exclusive.
And so what we push it, we have it on the skin, and it's gonna push, just like a needle, it's gonna push straight through the muscle, the skin and the muscle. So when we go in, we don't even have to pull the trigger first. When you put it on the skin, you just push down and you'll hit that bone. And as soon as you make contact with that bone, that's when you pull the trigger. Like you'll push in and it'll go in and hit, and then you pull, but when you pull the trigger, you're pushing down on it. Now you don't want to put all of your butt behind it.
Yeah.
It gotta be
But-
some more of these.
So it'd be like right here.
That's what I'm saying, cause they.
this
That one don't
made it to
even
bone.
reach.
Was this the right spot?
'Cause that's where I
So
ended up making
somebody
my mark.
is, the other needles are missing out of here.
'Cause that's where I made my mark right here. Right.
This one, right here.
That's
Yeah,
right.
anywhere in this, we want to try and hit in the head here too a little bit. We don't want to get down into like the growth plate.
Yeah.
But yeah, anywhere in that. But I hate that the other needles are missing. But
There's gotta be
ET
some somewhere.
to,
We'll find it when we don't need it.
yeah. But anyway, so what we need to do though is go through the process just so we can see. So we'll skip all this extra tissue. And say that, okay, we've just gone in and we've actually. And the battery's dead. All right, so we're going to pretend.
Oh, it's not dead. Just weak.
There.
Joseph.
Now it popped. All right, so see how when I was pushing, then finally it got to a point that it gave?
Mm-hmm.
So when this comes off, that is braced in there. This is now, when we take this, we're going to unscrew this cap.
Okay.
And when we unscrew this, then the stylet pulls out. Now, notice how that's anchored in. And again, there's no tissue on there, but that's, okay. So we have this.
Dang it, Joseph.
Way to break things.
It's Joseph's job. R.I.P., bro.
So that's in there. Now,
It's a prayer.
Yep, you got it. You getting it.
There's nothing. It doesn't go any farther
no,
back.
no yanking out, all right?
I
So
just shook it a little.
now with this, let's see, we got any of them that have actually got fluid in them? Even if they're open, just grab me a saline flush, or I can draw some out of a bag. Or,
Oh yeah, we got a bunch of flushes.
Okay, cool. So, what we need to do then is with our flush, we don't want to risk any sort of air insertion. So, we have our set here. What we would actually want to do is we start out, which technically somebody's already left fluid in here, but we would push the air out, right?
Mhm.
So this way there's no air in this. We're connecting this on here. Now, we're not pushing, we're drawing. It's called aspirating. So I should have some saline in here. Now what's gonna happen is I'm gonna pull back and draw, and you see how I'm getting an air return? Well, instead of an air return, there would be blood coming up into here. And I pull and I completely fill this tube with blood and get it all the way back in here. That's gonna tell me if I can pull that much, if I can pull enough to fill this tube, I'm exactly where I need to be. That's not pulling a little bit of blood from the surrounding muscle tissue. That is me
So how
deep in the
much-
core.
So what do we
Fluid would need
do
to be in
if
here.
So all we need is we pull, and we need just to see, just enough to fill here, and that's all.
Okay.
That's all I'm worried about.
What happens if we didn't hit? I know I'm assuming we can't use this side
Correct.
anymore, so we just have to switch to a new joint.
Correct.
All right.
So, I've got this. I've put it back, and I've had blood. I've got blood present in here. So, I kink this off, and I remove this. There we go. Now, say I've got whatever medication I need to administer. I can either just do it directly, or I can hang my IV set now.
Then you put the medicine in, and then you go behind it
If
with
yeah,
saline.
say I just needed to
Okay.
do that, but ideally I would want to have some. I would want more than just this port here. If we were hanging a bag, if we're hanging a drip set onto it, we would connect it here, and we would have a drug port. If I'm going to use it just for drug access, if for whatever reason I'm not hanging a bag, I'm not doing anything else, then I need to make sure that. So when I connect up and I push whatever that drug is, after I push that drug, I've got to put a saline flush on it
to
push
ensure.
it.
and
the-
push, because that
Right.
drug is like right in here now, and now I'm pushing the drug all the way in.
Okay.
Mhm.
Okay, but where's the fluid going?
Where
Inside
in-
the mannequin.
Yep. Right
Oh,
there.
it's coming out.
I was about to say I'll probably pop out someone down here.
Yeah, since that
Yep.
whole thing just sits in there. But that's it. Unfortunately, the battery's dead on there, so we don't get to run
There's
that
another
drill.
one somewhere.
But
There
as
has
I
to
was
be.
running it in, it hit that one point that it finally popped. Now, what they were showing as far as for when we do removing this, if we ever need to remove it, we don't want to try and grab on something that small. We take this right here, and we screw this on directly on top of it, and we can take this, and now we twist in the motion that would continue to tighten this, but we pull back, and
We removed their whole joint.
what it will do is as we pull, it just gives us a firm surface, a lot to grab on.
Why wouldn't we
Alright, I
unscrew
appreciate
it like you would do like a regular screw?
Because if you back it out like you're going to undo a screw,
Uh-huh.
That is gonna
this
come
will
off.
separate.
Yeah.
So what we're doing is we're turning, and that way the more we turn, the tighter it makes a grip on here until it bites good, and then we just yank it out.
Cool.
And that's it.
Fantastic.
Low substance. Alright, do we have a gun so we can punch that leg one good time?
No, we didn't find it. I looked on the truck.
This looks like it's bigger than that one.
It's still red, so it's probably the same size.
Yeah, the red ones are the same.
Yeah.
And then they got blue and yellow.
What house? Oh, it's
It is bigger.
Yeah.
Yeah.
Oh, go figure.
It must come from different companies.
Maybe.
So what's we look at the packaging. They do for the pediatrics, they do come in different ones.
Oh, one was
This one says
pediatric. Okay, one was
45
adult.
millimeter, 50 millimeter.
So this is 15 millimeter 15 gauge. Now, this may be able to get through all of this and then still get a good depth in the bone.
Yeah.
Yeah, I think
It
we
would?
can pop and pull it.
It's still, I thought it had more water. It was like, still? Jesus Christ.
So do they not?
Is it rechargeable or does it need?
No, so they just put, yeah, it's just a battery, and then there's not a charging port. It's just a lithium, of course, that way they can charge more.
Hold on, I'm gonna try it, but I don't wanna see the marks.
So you're gonna add, make it extra fluffy? Oh, okay, I see what you're saying.
Oh, okay.
I thought you were gonna put it on top of this, I was like, dang.
I'll put some tape on
I
top.
was like, who the hell is that?
Yeah, no, that's not gonna, it's gonna twist.
You said
Fabric will twist,
Yeah,
so.
we don't want to do that.
Yeah, it's fine, I mean, you're not gonna feel the same anatomical pieces on here anyway, so that's
I
fine.
was about to say, just
I'm
close your
more
eyes
so-
and feel for it.
I'm more so interested in you actually just kind of feeling that give when the bone pops, when
Okay.
you get through. So go ahead.
So we wanna go straight in. So we wanna go at an angle. Is this looking good?
So yeah, you pushed in until you hit the bone, right?
Uh-huh.
Okay.
No, it pushed too far.
Now you push, so you got the bone. Push
Go
it.
on.
Yeah, see, it's not gonna, even with that one, it's still not enough
To
depth.
go through.
Yeah,
Really?
to be able to get in where you need to be.
Oh, that's close.
But
Let's just try this and see.
so, here, let me put you back with this one again, because it's fabric and this rotates, so it'll bind and it'll just twist around it.
Maybe if I use tape, maybe.
There you go.
Oh. Okay. So I'm just gonna do it over here somewhere.
So once it pops, once you get that push through, you're where you need to be. And that's magnet, it just pops off. There you go. So hold the bottom and twist and undo the stylet. And you can put it in these, but the problem is it's a pain in the butt to get it back out of this. So.
I need fluids. Let's just say I'm putting fluids in this. Run it into the fluid. I'll run
I
it to
didn't
the
see
fluid
that.
pump. Then I would. Oh, probably still hold this one, don't smell. And then I would retract to see if I was in. I'm clearly in because all the blood came.
What to do?
Yeah, that was a bit much, so we pulled the syringe apart, but you know.
Okay, and after I do that, then
Now
if
you
I
drug
had
up.
medication,
Well, and yeah, you could hang your drip sets, you could put Novin, you could do whatever,
whatever
you need
I
to do
need
now.
to push, if I was just how to open this, then push meds, and then flush with the syringe. Okay, lock this back.
Alright, now show me how you would disconnect this whole setup if you had to.
Okay, I would just hold, secure, twist off. I would apply another syringe, ensuring it was tight, and then I would twist until I
yank back.
came.
Yeah, it doesn't take, the twisting is just
out.
to hold it, there you go.
And
It's
then
more
I would
so
use a
about
gauze.
bracing that hand and yanking it out,
Okay,
and then put some gauze.
and put
on.
pressure.
Now, we're not actually making pressure deep enough to affect, like, we're not as far as the bone, but just because of the skin right there where we did that. So. All right.
I did catch one mistake. I should have locked it, but I unlocked it.
This isn't where this came from.
Oh, it was on the board. I was using it to support the iPad.
Oh.
That's what was telling you.
I can pretend. I can pretend. I got a good imagination. Oh,
Keep going, keep going,
There it
keep
goes.
going.
Where's the thing?
Nine. And then she. Putting it in, no doubt.
wrong side. Let's put it on the right side first. Okay. Then. Aspirate. Make sure all this is full of blood, and then push it through.
blood back in?
You can flush it.
Stealing otherwise, Shalene. She didn't find
I
it.
always have afterthoughts. Like,
She didn't find it funny.
It's
She was
like it
like,
takes a second for it to set in. It's like, oh, haha, that's funny.
y'all some vampires, so it's okay. Always trying to take my blood.
Bam.
Nice. That cool. I want to turn. And he's supposed to be in the store.
You're supposed to be here by 11. but I kinda wanted to touch base with him to figure out.
I got it.
Okay, so we're done with this. Oh, we gotta do the leg. Can we do the leg later?
Just was touching base about plan, because was that point to either break for
Should we
lunch
have a talk?
or do a little more, comma, and was just trying to clarify what it was you said you wanted.
You did it
Since
all wrong.
I
Here's
was
your
really
fork,
tired
sir.
of talking to you.
That was quick. I didn't think I was gonna mess up that fast.
What
Oh,
do
I
you
know.
need next, doctor?
Not bad. Let me get thank you.
Aspirate. Look at the mirror. Okay, here is your salad. That was killing me. Especially, but I get what you did, but I'm thinking,
We just stole their blood.
I give it back. I felt bad.
now we do salad.
Cause I was confused with what Frank was saying this morning about like the students, the other folks coming in the tour and stuff. And I wasn't saying, I didn't understand whether he was saying he wanted us here or he didn't want us here. Cause at first it sounded like.
Call
he-
Frank and text him 911.
Well, I called him and he sent me a thing and he said, I'm on a conference call, I can't answer. What do you need? I was like, well, I don't know what you want. I don't know what I'm supposed to be doing.
Send him an A in
Winging
a
it.
circle.
Wanging it.
No, he's fine. Okay, so what is the top to these things? Is this the top to?
Oh, I forgot to clench that thing.
None of y'all are serious. I gotta be so slow right now. Okay, you go.
Why?
Because I'm trying to find the top to these.
Oh.
What? Oh yeah.
Is this?
Everyone say hi to Joseph. Slacker.
Right, so we can show Joseph what he missed, hold on.
Yeah.
Oh, yeah.
How do I do, there it is.
A little bit back.
Yeah, so that's a nail gun.
Let me focus it. There we go.
Yep.
What is 5mm?
The knife I think you've seen, but that's what a bullet will do to a femur.
There.
That's what a bullet will do to a humerus.
Oh, he's like actively on?
And that's what a table saw will do to your fingers. Push through. Okay, so Frank needs us out of here. He wants to do the tour at 12:30, so he said, don't take lunch, keep working, and then break so he can do a tour at 12:30. So that's what we're gonna do. We're not gonna take lunch, we're just gonna work for a little bit longer, and then we're gonna call it a day.
Alright, cool. Maybe I can get my haircut. Look at this.
One
I
day-
don't need a haircut.
One day I'm gonna go back and they're gonna actually have the same person there to cut my hair twice, because there's one girl that did it good and then I've never seen her again, and it's just a gamble. I go in and whoever's there is there, and
Where do you go get your haircut?
Great Clips.
Nah, bro. See, you can't trust chain barbershops, man.
No, and
That's-
every time I go in, and so it's like, and I told him like, well, so you want it just like your notes? I'm like, well, the notes say the exact same thing, but y'all never cut it the same. I was like, the girl that cut it here last time did perfect. Where is she? When does she work again? Oh, she doesn't work here anymore.
She
Okay.
realized she was gonna make real money.
So-
Nah, but I go to Nappy Root. Nappy Root, man. It's right there by
Yes, it's
Station
right
10.
beside the station.
Yeah.
Yeah, except for
That's
that the
what I
one
said,
time, oh, we went over there one time, but it was a wait. Like, they were like, oh, it's gonna be like 45 minutes.
Yeah.
It's like, I can't do that.
Well, what you do is you go in and you tell them, "Hey, I gotta, I'm waiting. I gotta go check on some things. Can I come back and I'll be right in?" He'll be like, "Yeah, sure. You got like 2 people in front of you. They'll either let you know or you just come in at a time. Like you don't have to wait there. Like if they know you came in and checked in, they got you."
Well, this was just, we was there on shift when they were like, hey, let's get a haircut.
Manny
Do we
Petty.
know where the baby leg is? I've seen it around
It's
before.
a baby leg.
Yeah, there's a baby leg bolted to a board in here somewhere.
What?
So that's what that's for.
I know. Oh shit. I think
I
it's over
ain't
here.
seen no baby leg. Y'all
I
play.
saw no, it was over here. I remember what you're talking about. I just remember seeing it. I was like, this isn't weird at all. We just got baby limbs.
Just a baby board.
Just baby limbs.
Yes, baby leg on a board. And
Just so casual. It's just a baby leg on the board. I don't know.
It's whatever it is.
So we're working until 12:30.
Yep. And then we're calling it a day.
What hour?
Yeah. What do you call
And
it?
we
So
gonna do
just
the
take
baby
this one
leg?
off. We're not using this one.
I mean, we can go ahead and do that one.
I don't know where baby leg is. Are we not? Are we sure that someone didn't just come in here and take it, like one of the nurses or whatever?
No, we're not. Like,
Maybe it's in one of these simulation bags.
Oh, there's a whole aisle in here.
Yeetus the fetus. They don't appreciate that. Don't use that one. If you ever get someone pregnant, texting a woman, Yeetus the fetus, I'll pay for it, is not the answer.
If you're the one that got them pregnant, that's a little bit insensitive, but you know, whatever.
I don't think it's insensitive. If anything, it's very proactive. I answered your text message, didn't I?
Fetus, the fetus that you would use.
Is Joseph over
Look
there?
at me and ask that question again.
Did y'all forget
I
about
know you
Joseph?
would.
Oh, yeah, would it or would?
You would not.
Lies.
Oh, bullshit. If you knew if it was your kid, no, I don't think you would.
I don't know kids. I don't know what I know kids.
Alright. Have you guys had a chance to play with
Unless I can name the kid Dream Crusher. I don't want a kid.
with an atomizer yet?
No.
Okay, so here, this is an atomizer.
I've done it on the truck, but they put it
And
on
many of them have nostrils.
I think all of them have nostrils.
This one over here is
It's
good.
digital. I don't know if we want to do it mechanically. Like he has the whole.
The one laying down.
This
over
one
here.
has nostrils.
There you go.
Not very big.
So hold it out here one time just to see what it does. But yeah, so the idea is it's supposed to aerosol mist, right? But look what really happens.
That's not too bad, but yeah, it's.
Why haven't we used
I need one of these at home for my nose.
Look,
You know,
I
yeah,
thought
get a
I
neti
bought
pot.
it in the
Get a neti pot.
I bought it in the garage.
But you take it and
Can I just get a little distance on it and just be like, yo, open your nose real hard, boo, and just be like.
so I gave it to I had an EMT writing, I said, do you know how to use this? He said, yeah, we just put it in their nose and push, right? I said, yeah. So he put it in their nose
He
and he
slammed it.
pushed the whole thing and it went boom. And I was like,
Oh
oh my
my
God,
God.
stop.
Oh Lord, then they had to get that out.
And I was like,
What was she doing?
and it luckily
Everything
came
came
out
back.
with it.
Yeah.
But yeah, he went, stuck it on the nose and went.
Was this person was conscious, right? Oh, good. I was about to be like,
It
man.
was an overdose.
I was
Does
a
the
crackhead.
neti pot work good?
Yes.
But in the body and everything.
I haven't tried the Navage, but I can just tell you
What
that
does the neti
Let
pot do?
them
everybody
spray
here
those.
comes out here, everything clears out.
The
Same as if you
Navage,
can
you
get
put
one.
it, it got two nose things and the water go through one
You
and
know
it
when-
suck out the other one and then you can rotate it and suck it.
You know the bulb syringes you use to
I
suck
love
the
it.
boogers out of the baby's nose? Fill it up with water, it does the exact same thing.
You
You
got
cl-
the cheap part and I didn't even think about that.
I used to do it to Caroline all the time because the child stayed congested. I just bend her over and shoot it through and it'd come out the other nostril and all the gunk would come out too.
That's a good one.
Either that or plug up the other side and then suction it. If those are still long enough, but the shooting the water through the nose.
My friend of mine, during the election,
I've done that with
Georgia went
St.
blue.
Louis, though.
She basically gave out free blue peach tattoos. There's like a bunch of people walking around like Georgia and like a peach, and then it
I
says.
need to start using that thing more.
But just so y'all can see how it actually works.
Oh, let's get wet. My little daughter would love
No
to
way.
be outside just like running through the mist.
But I just wanted
girl.
y'all to actually like get a chance to play with it. So what else
Okay,
in
let me
here,
see.
what else in here have y'all not played with that you want to?
Extrication
The
equipment,
test.
like a chainsaw or saw.
Do we have a chainsaw yet?
I want to do extrication. Training.
I don't think we've messed with IM stuff, have we?
I don't think so. No, I haven't.
Sounds good.
Yeah, those boas from North American Rescue are like.
We ain't never played
8,
with
9,
her.
10
before.
Yeah, if you buy them in bulk,
Can you
they
get
get a
them
little
on
bit
Amazon?
cheaper. Yep, I buy them on, I bought them on Amazon, there was a guy that's reselling a bulk pack of them, and that's how
Do
we
you know
got
what
them a little
she's
bit
for?
cheaper.
We never have touched this manicure.
I mean, I would use these for other,
So,
Look, she got holes
I
like
rode
right
on the
here.
clinical
What is this for?
I rode on a truck not this past Sunday, but the Sunday before I rode on M3, and we rolled into a suicidal allegation, and dude put on a whole vest, and I was trying to explain what you did to yours to him, and I couldn't, I was like, he made it magnetic, and he was like, how? I was like,
He just did.
he used magic, he used wizardry. But what did you do to your vest to make it like that?
I have some little neodymium, however you say that word, magnet strips, and a duct tape on the back of it, and just to hold them together so that they didn't fold and overlap. But then I originally stuck the flat molly, but then later I stuck it in front of the vest, and then I just did a quick spray of some Rhinoline over it, so it kind of bound it all together.
Nice.
Alright, yeah.
What, y'all didn't clean up the mess up with the pipes?
Can we just go
I
over
was
some
being restrained. It's
scenarios?
not my job to
Can we
get
just
clean.
get a
I'm
medicine,
not
get a
gonna try to
mannequin
restrain you here.
scenario?
All three of them, I just took them off. I was like,
That's
no sticks for me.
No
They
sticks for me?
they didn't agree to that.
Can we just do that?
What are we doing?
We can just get a mannequin and run through some scenarios.
No. You would think, but no.
Really?
Yeah.
Try.
Go on, hop on board.
Not like doing like that, not using two hands pulling. Try ripping it just by moving your
yeah.
arm.
Yeah.
You look like a T-Rex.
I actually have a friend who, the drunker he gets, the higher his arms go, so by the time he is full drunk, he's right here. You ever seen a man, 5'10", about 225 pounds, try to throw a ball like this?
Why?
A whole bunch of weight goes one direction, and then he,
Why?
surprisingly
Do
accurate.
that.
He's surprisingly accurate.
alright, so there's that. Alright, pick a mannequin. Throw them on the stretcher.
Which one?
Doesn't matter, I don't care.
Not
Do you
that
want, do you want to,
expensive one.
yeah, I was about to say, do you want to go
Not
with the
that
expensive one, or do you want to go with
Whatever
the?
you feel like moving, I don't care.
Because
Whatever,
the,
I don't know that.
Not that expensive.
well, we got that one back on here anyway, so.
You gonna put it on there? That means he gonna be able to control respiratory, everything. He gonna be able to.
We're not doing all that, we're not getting that involved with it.
How's it going? That locked?
You're locked.
Yes, I'm grabbing it.
Yeah. Hold it. Hold on, honey.
Lift it up, bring it out.
There you go.
Are we going outside in the snow?
No,
I
it's
need
too
to
hot
keep
for all
it on
that, that's
arm, man.
why,
Let's take it one
that's
arm.
why I was just saying, just put them on there. And we're just gonna go directly to that.
We have to put them on there.
Yeah, making a lot more work, all I was gonna do was just, have you literally just take whatever light mannequin and throw him up in the stretcher on
Oh, we were gonna put this one back.
the
that's
thing
why.
and call it a day.
1, 2, 3. Go along the wires for me. He's not heavy. He's just awkward. He's like a. He's not heavy. He's just. You know how dead weight just feels weird when you're moving it.
You got him?
Not heavy. It's just
Weird.
90% cord. See what I mean? Every time you move one thing, another limb wants to throw itself off. He's an asshole. Like his father and his father before him.
Oh, we must go do stuff on Amazon.
Oh, you're cool. All right. Anytime you're ready.
Something on the spot. Yeah. This side is here.
Yeah, I'm good.
1, 2,
Yeah, but it's two different transports, y'all in the
Ow,
highway.
my wrist.
It's not gonna count.
Should. There we go.
Oh, my God.
As locked as it's gonna get.
It's good.
Watch out.
Amon, put that seatbelt up. What's up there?
Here you go.
Good job.
What up, B? I got to work a car accident, like complete accident yesterday.
How
So
was
I
that?
was-
Like you
I was-
witnessed it and then.
Yeah, pretty much. Well, I didn't witness it, so it happened literally. I'm going off site to work, and as we're leaving, we hear a crash. Like when we're at the house, we're like, "Dang, something happened." Oh well, not my problem. And I'm just driving around, and then it's right there in front of the exit. I'm like, "Oh, dang." So I get out. I go to the guy who slammed this girl. He was fine. He got up. He was like, "Airbag hit me in the chest a little." I like fucking around. And then I checked on the girl, and she was just like, "My husband's going to kill me." Like, this is his
I'm
car,
stopped
he's
at
going
an
to
accident
see.
too.
And I was just like, "Big girl,
I thought it was the only person who
Lame.
did that.
I mean, I don't want to do that." But, they're not the classics. It's the Evo model. Not the brand new one. It's probably like, I don't know, 6 or 7 years. Yeah. Like, this is my, it had nice tires on it. I was like, they may still have that car, but I'd salvage those
We're
tires.
gonna do this scenario together and see. He's right, this scenario.
I gotta run lead on the call, so I'm finally done with that. I got all my PCRs turned in, so I got 10.
I haven't been, I've done over 10. Yesterday alone, I did 6.
No, lead on the truck, not on the, not you don't do
What do
it,
you do?
PR.
No, I haven't done it, but I've done 6.
Thanks, man. I only got 4
You only got 4.
PCRs.
Did you do PCRs for the ER?
Everything, yeah. It was a slow night, man.
We're gonna do one, we're gonna pick a number, 1 through 20. And whoever is the farthest away is gonna take one of this. So pick a number 1 through 20. Okay.
10.
Okay. The number is 14. So, time is up. Alright, so, you'll be lead, they will not be able to offer anything verbally, but they can follow your command. And that's gonna be it. So, we're going to cut to the chase, we're not gonna go outside and not do anything else. But he's actually, I was going to finish as right here in the school. So, what we're gonna say is that you've been called in, you're here, and somebody came to you and got you. Because I want you to have full, like, I want you to have access to more things. Because I was gonna be more so about you just evaluating and asking appropriate questions and items, but I want you to be able to administer things. So, you respond to Columbus Technical College for reports of a teacher who the student said that he started looking pale, and he started complaining of weakness and nausea.
Okay, so I roll up, I eat out on that.
Okay?
And then, I pull up, is this one patient?
It is only patient.
So I pull up, I find my patient, I walk up, and, are they conscious?
Yes.
What's their level of consciousness?
He is conscious, he looks at you, visually engages you walking in, and he's capable of speaking your phone.
Okay, so I walk up to him, I say, "Hey, how you doing?" So he's like,
It says, I'm feeling pretty shitty right now.
sorry. So
So
while
his
I'm speaking,
his position will say, no, he's not sitting. But will say he's sitting but leaned back in his chair. So he's sitting in the chair, but he's leaned way back, like that.
just relax.
Like a full length. Okay. His general appearance to you is not that, yeah, it's not that textbook, but he does have, and he is paying on appearance. Right?
That's the first thing I asked him is, what was you doing? What is that?
He was just teaching. He was standing up front teaching, and he said that he felt just a little something, he said he almost felt like a little bit of nausea, and then he just kind of started hurting and feeling weak, and so he sat down, and Stevie said he looked at so they called out.
So from there, I'm asking him, what was the last thing he ate while I have them check for BP, and put on pulse ox.
Okay.
And then they're gonna check, on the respiration.
Okay, and he advises you that he had Starbucks this morning, his normal, nothing out of the ordinary. He had a, Frappa, Maca, something, whatever the Starbucks. He had a bougie coffee. He always had bougie coffee. So, continue. Alright, meanwhile, she's obtaining the blood pressure. What else do you wanna know besides blood pressure?
I said blood pressure, respirations, I wanted you to check respiration rate, I wanted you to put pulse ox on,
Okay.
and, check BP. Go ahead and, get blood glucose to,
Okay, pulse ox is on O2 side, is 97 on Premier. Heart rate is fluctuating between 92 and 94. Your blood pressure is being maintained right, and blood glucose is being maintained. As far as your respiratory, what she notices the respirations are regular, only affected by this verbally answering your questions, and appears to be around the present.
so no deviation. So I asked him, so I already asked him,
Your blood sugar is 118.
and I go ahead and I ask him. I already asked him about what he ate, I asked him about what he was doing beforehand. I asked him if he's had this kind of problem before.
No, he's never had any problems like this. It says he's had similar things, never this bad, but only when he was working outside in the yard or doing something really strenuous, particularly when it's not outside.
Well, I'm gonna go ahead and ask for medical
BP
history.
is 98 over 56.
So I'm gonna go ahead and ask him if he has medical history and if he has any allergies.
He has no known allergies that he's aware of. His only medical history is he had some knee surgery 2 years ago.
Okay,
He sometimes takes an ibuprofen. That's it. Nothing prescription.
so I'm gonna go ahead and tell him to check his just to see.
Okay.
So I checked all 4 quadrants for
So abdomen is tender, non-rigid, no distension noted.
yeah, we already know he's pale.
So visual appearance, you see he's just pale in appearance, he does appear, like I said, very wet, borderline diving, I think.
I mean, I wanna hook him up to, an IV and like pump up that blood pressure. It doesn't say anything, but I don't know.
What have we done investigative, other than you asked him what he had to eat, and
Medical history.
you palpated his stomach, we've asked about medical history, but about this individual event, the only things we've said is that he's had a similar episode that onset during stressful, during heavy manual effort, working outside in the
He's
sun.
just teaching.
Exactly, he said he was teaching today, and his complaints were.
What does he teach?
Sudden onset, he teaches the EMS program, but, sudden onset, he had that nausea that came about, weakness, and also some depression that. So, we've got all the things leading us up to this point, right? What else can we be investigating? So I know you want to go ahead and get IV access, but what else?
Just kill my freaking picture.
Alright, anybody want to tap in?
Okay,
Where's the pain?
where's the pain located?
Thank you.
First of all?
So, he says it's a pain that's all in here, he thinks it's, just heartburn, but it's
all in here. When he describes the pain, he makes a hand motion just like I just did. He makes a fist, squeezes his fist in, and presses it in towards his chest as he slightly moves forward and says it hurts right here.
Does he exercise? Has
Alright.
he been
No,
doing
he is not doing regular exercise.
Is it possible that he has hurt his muscle, what is it called?
No falls, no recent injuries.
Alright, how old is him? Or,
He's 54.
And you say that his blood pressure was low?
Correct.
Really low.
So,
And his
it's
abdomen is
not-
tender?
so it's low, but it's not,
it's 98, so, right?
but also his heart rate is elevated and his respiratory rate is elevated.
I thought I had to put him on oxygen.
Yeah.
Put him on insulin.
Yeah, I'm gonna go ahead, I wanna put him in,
What was his
let's
rate?
go 4 liters per minute with the Nizocaine.
How old is he?
Okay.
And then. I'm just gonna start asking him, he already said he's never had chest pain, this other one he was working, he was doing heavy lifting and stuff like that.
Extremely effective stress.
He a lot of them.
Yeah, he is a little, I should have said that. But,
What are options?
Hey, what's up?
What are things?
There?
thing is, I don't wanna say, I'm gonna
Earlier you-
totally on him.
Okay. Well, prior to that though, what we should be doing
There.
right now is we should be making a list.
Yeah,
So,
you're good now.
we're gonna make that
I'm
list.
already
So
making
let's-
this, I'm
so
thinking
let's
like
list
acid
what things-
reflux,
Okay, so we'll put acid reflux down.
GERD, something
So
along those
acid
lines.
reflux is absolutely something we can be concerned about. What else?
Can't do it.
Well, just, right now, we're just making a
Or
list.
just-
We're
it
just,
could be
so,
cardiac
because
related.
we're.
That's what I'm
we are-
thinking it is, that's why I'm putting him in the 12
Cardiac
week.
related,
So cardiac, it could be cardiac
could
related,
be
it could be acid reflux, what
maybe.
else? Okay, we'll just say potential, ulcer, like maybe a
Yeah.
GI,
Yeah.
something GI ulcer related, all that, okay? So, anything else we wanna add on our list?
I want to listen to lungs.
Okay.
I mean, I know it ain't really respiratory related.
Alright, well, no,
though.
but that's good, so, and listen, one sounds are clear. Alright, so when we're doing things like this, we're coming up with a list in our head, hey, what do we think could be going on? Now we've got that list, and we're just gonna stick with just these three. So, based on these three, what can we do to narrow it down? What can we need to be, once
I
we
want to
have
ask
that
him
list-
questions about, he said it's induced by stress.
Mhm.
So I'm leaning towards, it's some
Something
cardiac. But,
So-
he said he had cough.
So let's take all three of these and we'll ask questions that can either confirm something or rule it out. Now, the
Okay.
fact that it was onset by stress, that absolutely can be acid reflux, that could be cardiac, and that could be peptic ulcer, that could be some kind of GI,
Yeah, that's it.
something like that. So that doesn't really, and the fact that the stress was kind of manual labor, and me personally, I'm starting to
Is
think
there anything
maybe
that
it
we
was
do to make it feel
stable
better or
angina
worse?
before.
Right,
That's what I was-
that's what I was.
So, the fact, and we had no tenderness on palpation yet and all that, and the fact that he made a gesture here, one shows me that it's higher up, two shows me that this is more of a, I'm leaning more towards cardiac, now, this could be cardiac, or this could be, like I said, this could be some kind of real severe acid reflux that has gotten to the point that now it's causing some sort of ulcer. And both of those are really, absolutely different things. Now, what we should do, what else can we do to maybe rule out like pre-existence of GI disease, things like that?
Yeah,
We have
blood in
any-
your stool,
Yeah,
what blood is your food?
so his bowel, he tells us his bowel movements have been completely normal. He's had no issues with that. We can ask about vomiting or anything coming up, anything like that. Any change in your appetite, nausea. So he denies anything appetite, nausea related, anything like that. Well, and then we can even specifically say, have you ever had with heartburn or acid reflux? And, these could answer generically, sometimes,
wanting you to, because we're at a point we should be problem solving, we should be looking at a bigger picture, we should be coming up with a list of things, and we should be asking questions. And since you threw these things out, I mean, everything you asked, I'm gonna give you an answer. You asked about, all the bowel moves, you asked about food, you asked about that, you asked about cardiac. So sure, on the cardiac monitor, we'll CST elevation, so we'll look and go in that direction. We'll say, you see things that are developed for water treatment.
As
What's our dosage?
yeah, max is 481 milligrams. Yeah, you one now. Check out nitro. Nitro, no. Just put it at 98, and well, what's your GP now?
So what's our technical limit for?
As soon as it goes below 90, 90 or below.
I understand, fine with that, I'm good. I figure with about 12, that way you go.
Okay, yeah, I gotta put this class
Just
together.
a little buffer. They're almost done with this.
I'm gonna find out if I was the latest human protein next week. Up to these two tours, I'm gonna get the last one.
Yeah.
And I thought it was gonna be 5-10 minutes, tell them how to program their release. And you're gonna have those students for hours.
What's students?
High school students.
Oh, no.
Yeah, no, don't worry.
So, we can go through your suitcase. Nitro, you are right.
Are you leaving now?
I gotta run upstairs for something. I'll be back down here in a little bit.
Situational, and then, you're gonna put these in here, so I truly feel something, I may do something, right, I may fish, I may, and I may make that choice a little bit and move with the natural. A lot of it's just gonna be dependent upon the utilization of the things like that. I just wanted to put stuff there to kind of get you thinking through processes. But again, this was more so just, I want to be systematic approach of something. Come up with a list of, because that's where we.
So what was the problem?
I left it open-ended. I did a basis of cardiac. That was my original plan, was cardiac, but my goal was to try not get you specifically honed in on cardiac. I wanted you to be looking at multiple options. And as long as you're doing that, that was good. I was happy with anything that would fit what we were looking at. So, and then you kind of rules it back. So, good deal. Right. Well, I think we'll leave this thing powered on for him.
Okay, let's try to straighten up.
Wow, y'all left, this thing just sitting for him? Well, this has been in here, y'all should have videoed the, blame this guy right here for forgetting to, go in and film the scenarios.
The one scenario.
Come on, you gotta